Why today we are invited very one of the fresh candidate who is Mr. Ikram Raza, Dr. Ikram Raza, and our mentor, Dr. Monis Raza. He basically belongs to Dera Ghazi Khan. मेरी ज़बान सराइकी ज़बान से ताल्लुक़ है और जो डेरा गाजी खां की ख़ास खसूसियत है ना, सबसे ज़हीन तरीन पाकिस्तान के लोग इस हिस्से में रहते हैं. Thank you very much. I'm not wasting the time. Over to you, Dr. Salma, a few minutes. And then I hope you are on the way. Maybe there is some internet disconnection or something. Professor Salma Kondi is a principal and owner of the Women Medical and Dental College in Salma in Aptabad, and we have started these educational webinar from the last 3 years. Over to you, Professor Salma Gandhi. Are you hearing, madam? Okay, I think there may be some issues on the. Over to you, Dr. Maniz Raza.
Assalamu alaikum, everyone. Thank you, Dr. Bukhari, for giving me the time. So, थोड़ा सा brief introduction about me. So, I did graduation from Mr. Medical College. I did graduate in 2012, and then I did my internship. Then I completed my USMLE exams. So then I came here in US in 2014, applied for the match and got matched in 2015. Did my internal medicine training in Michigan till 2018. Then I completed advanced heart failure fellowship and then did general cardiology and the interventional cardiology fellowship. So like 5 years of training at University of Louisville. Currently, I'm working as an interventional cardiologist in Missouri, Cape Girardeau. It's near St. Louis, one of the smaller towns where we have to do as a part of our a visa process, waiver process once we are on J1. So yes, I think so for starting with the career counseling about like how to navigate through the process. I think the process have uh, काफी easy हो गया as compared to when we were preparing for the USMLE exams. Now, as you know, step one is only pass and fail as compared to when we were doing exams. So step one was taking like almost 15 months. Now, I think the perfect scenario for any student, if I talk to anyone, so the perfect scenario is to give the step one exam during your MBBS because it's a pass and fail, so you guys can easily take it in the fourth year. That would be the best time to take this USMLE Step 1 exams. And then regarding the books and what to do, I think Ikram will cover that portion, like which books are good, and then definitely the question banks. And then I think the perfect time to take the USMLE Step 2 CK exam is right after the final prof. Because why I'm stressing so much, like why you guys have to take during the MBBS is because once you come to US, it's a huge competition. Like you are not only competing with Pakistan, you are competing with the whole world. So you are competing, your main competitors are people from India, like all over the world. Because now why like US is still relying on IMGs because the thing is there's still shortfall of doctors here in US. So US medical schools are not enough to fulfill those parts, and that definitely the population is expanding. The hospital every day the new hospital is opening up. The cities are growing as well. So and US is huge. So I think US is one of those countries which has like still like the job market will still remain open for international medical graduates, anyone coming from outside the US. It has a lot of opportunity for the doctors. So basically what you do is after step one and step two, so the year of graduation matters a lot. So when you're competing, so they don't only take your look at your USMLE scores, but they also take look at your other stuff. So it's not like how you guys take MD-CAT in Pakistan. So you just take the MD-CAT and then you have the scores and then you apply. So you get the interview calls based on that. So no, it doesn't work like that in US. There are almost like 500 programs in internal medicine. There are different specialties, as you guys know. So then for in that to come.
Please mute your mics. Okay.
जी जी तो
Please mute your mics. Okay, otherwise I will mute all the mics. Okay, please continue, doctor.
जी जी। तो उसके बाद ये होता है कि आपकी ईयर ग्रेजुएशन मैटर बहुत करती है। उसके बाद नॉट ओनली सो यू विल ओनली हैव यूएसएमएल स्टेप 2 सीके स्कोर, and then year of graduation is extremely important to get match here in US. And then other thing, the next step would be to take OET exam, which is not very tough, because in our time the clinical skills exam was very tough and people used to not pass it on first attempt, so it was creating a lot of issues back then, like 10 years ago before COVID. But now OET exam is very easy, so you guys can take it easily from Pakistan. So once you have step 1, step 2 and OET, you guys are basically ECFMG certified, and you can apply for the training here in US. And then the next step is comes you have to come to US. You have to apply for clinical observerships, which are not that hard to get these days, but still a little bit difficult, but more than happy to help anyone who need clinical observerships. And then while you're doing clinical observerships, so you have to take the USMLE step 3 exam as well. So although step 3 is not a requirement, but it has become kind of a requirement, especially for IMGs. Because from last 5 6 years, everyone is taking step 3 exam before they start the residency. Although it's supposed to be taken during the residency. So step 3 is kind of a similar exam to step 2 CK. So yes, so you have to take step 1, 2, 3, and then OET exam to be competitive in the exam. Sorry, to be competitive in the match. So, and then what things matters is definitely your year of graduation matters a lot. Your score in step 2 CK, your score in step 3, you have to score really good. So you should not take the exam without giving NBME or forms, which tells you like where you are in your preparation right now. So you have to score very good at least. And then once you come to US, so then the question is, which specialty do you want to go into? Definitely. So basically, we IMGs mostly match in those, because then at the same time in US, when you come to US, so you're also competing with US graduates as well, the people who are graduating from medical schools in US. So most of the IMGs, we do match in internal medicine, because the main thing is because they have a lot of seats in internal medicine. So there's almost like at least 50% every year people match our IMGs in internal medicine. So it's easy as compared to other specialties. But if anyone who wants to go in the route of some other specialty, like let's say neurosurgery, surgery, vascular surgery, yes, you can still take it, but you have to then at least do 2 3 years of research here in US to compete with the US graduate, so that that the program should take you instead of taking a US graduate. So yes, so the options are still there, but it depends how much time you have, and how much you want to spend here, and how you want to build up your CV for that comparative field. Yes, definitely family medicine is there as well. Family medicine is it's a very good specialty here, especially if you someone who wants to go into PCP outpatient route. It's a again, so in family medicine and internal medicine, it's a lot of IMDs match, so it's a little bit easier as compared to surgery and other fields. Yes, peds as well. Peds, so these all internal medicine fields: peds, neurology, internal medicine, family medicine. So these are the fields where most of the IMDs goes. Yes, also for emergency medicine, things have changed a little bit. So in the past, a lot of US graduates wanted to go into ED, but now the things have changed. Now a lot of people IMDs are getting matched into ED as well, due to some job market issues. Or now a lot of US graduates are not going into ED. Same thing for pathology. Yes, pathology, a lot of IMGs match. So if someone wants to go into some like subspecialty, like pathology, like neurology, peds, ER, so you have to build up your CV according to that field, because in internal medicine, it's a default field. You can easily get 2 or 3 rotations in that field. But as compared to other field like pathology, neurology, you have to build up your CV. Like you need at least 6 7 months of clinical experience in that field to show it to the program that you are really interested in that field. It's not like that someone is just applying to get match in US. They just want to make sure that. and then comes the psychiatry. Psychiatry has become a little bit competitive in recent years because of the lifestyle and a lot of US medical graduates coming into this field. So now the next question is, what other things matter? So the one of the major other thing matters is your communication skills. So your spoken English, it's extremely important. That's what they're looking for in the Zoom interview. That's what they want to make sure that if someone's coming to start their residency, they don't want to spend a lot of time helping that new resident to help him with the communication skills, because you will be starting seeing the patients from day one, and then you will be almost independent. Definitely, you will be under the supervision of the senior resident and attending, but your communication skills matters a lot. तो अगर अगर किसी के इंग्लिश आई थिंक स्पोकन इंग्लिश का मसला है बिफोर कमिंग टू यूएस, आई always recommend to take spoken English courses. So I think that's extremely important, because again, once you come to do observerships and everything, so your English should be very good, so that you can make connection, you can make networking, so that and you should be very good in communication skills, not only spoken English but also emailing and different kind of stuff. So and then the other thing, yes, I think this would be like a brief overview of how to go to come into US. So I would compare the different options, like as compared to staying in Pakistan, going to Australia, England, or the US. I still believe, I think that the career growth is in US, because once you get into a system here in US, then different options are open for you. So I think they have tremendous opportunity for the career growth as compared to UK and Australia. So I think, let's say if I started internal medicine training, after that I have like more than 10 specialties, whichever specialty I want to go into for subspecialty training, like starting from cardiology, GI, hemonc, pathology is not, sorry, but not part of like medicine. Pathology is separate field. Yeah, so pulmonary, critical care, infectious disease, nephrology, you name it. So there are tons of different specialties. Again, we have to then apply for the match, we have to prepare for the CV. That's a later part of your career. But I would say the most I think that the career growth opportunities are here in US. I don't want to say, but I think getting a training spot these days in Pakistan is actually is more competitive than getting a training spot in US, because I think definitely things have changed. Like I left like Pakistan more than 10 years ago. I think now you have to do the BHU, you have to take them certain number of spots. That I'm not the one who's master in that, so you guys know, can someone else. But I think getting a training spot in US is much easier than getting a state training spot in Pakistan, even Australia and UK, because in Australia and UK you have to do a medical officer job and then house officer job, and then you have to transition to other specialties, and getting a subspecialist spot there, it's a little bit competitive. I think so, but I might be wrong. So yes, I think this is a brief overview. Then I think I'm open to questions, so we